Hi, my name is Carol Karstensen. I'm part of the Medicare Made Clear team. And I know from trying to learn about it myself just how much there is to know about Medicare. It can be kind of overwhelming at times, even if you've been at it for years. So today, I'm going to go over the basics of Medicare, because a strong foundation in the basics is going to help you understand your choices and make better Medicare decisions for yourself. We'll start at the beginning and talk a little bit about what Medicare is and who can get it. Then we'll talk about the parts of Medicare, what they cover, what they cost, and then we'll go into how to put those parts together to come up with coverage that works for you. So let's get started. Medicare is a federal health insurance program for people 65 and older and others who have qualifying disabilities. You also need to be a United States citizen or a legal resident. If you're a legal resident, you need to have lived in the country for at least 5 years in a row, including the 5 years just before you enroll in Medicare. Another important thing about Medicare is its individual insurance, meaning every individual person needs to qualify for it themselves, enroll in it, and choose coverage for themselves. This can be different from what you're used to if you've had a family health plan through an employer, for example. Government-sponsored Medicare is made up of two parts, Part A and Part B. Each part covers certain healthcare services. The two together are often called the original Medicare, or sometimes traditional Medicare. There's also a Part C and a Part D, and Medicare supplement insurance, and we'll get to those in a little bit. So let's start with Part A. Part A is hospital insurance. It covers inpatient care when you're in the hospital or a skilled nursing facility. It covers your room, your meals, your nursing services when you're in the hospital, any equipment or supplies that are used in your care, operating room, whatever the needs are that you have while you're in the hospital or in a skilled nursing facility. Medicare Part B is medical insurance. It covers your doctor visits or your doctor services even when you're in the hospital. Other things covered by Part B include care when you're in an outpatient facility, like a clinic or the emergency room, for example. Ambulance services if you need to go to the emergency room. Preventive care services like flu shots, medical devices that you might use at home, such as a wheelchair. Original Medicare, again, has Part A and Part B, and it does come with some costs. Those costs can include premiums, deductibles, copays, and coinsurance. Now let's start with Part A. Part A, in fact, is premium-free for most people. If you've worked and paid taxes, or your spouse has, for at least 10 years, then you get Part A premium-free. Otherwise, you would have to pay a premium. Other costs for Part A include a deductible and some copays and coinsurance. But importantly, you only pay for Part A when you're actually receiving Part A services, such as when you go in the hospital. So Medicare Part B does come with a premium, and that will be deducted out of your Social Security check if you receive Social Security. Otherwise, you'll need to pay it directly to Medicare. Other costs with Part B include some copays, a deductible, and some coinsurance. For most services, you pay 20% coinsurance, and that means you pay 20% of the Medicare-approved amount for that service, and Medicare pays 80%. So we've talked about original Medicare, Part A and Part B, what they cover and what they cost. But they don't cover everything. Neither Part A nor Part B covers prescription drugs, for example, dental or vision or hearing care. This is where Part C, Part D, and Medicare supplement insurance come in. They offer you more coverage options. Let's start with Part C. Part C is Medicare Advantage. Medicare Advantage plans are offered by private insurance companies. They cover everything that Original Medicare covers, all of your Part A benefits and Part B benefits. In addition, most plans will include prescription drug coverage, and additional benefits like dental and vision coverage. The costs for a Medicare Advantage plan might include a premium or it might not. There are some plans that have $0 premiums. Other costs would include co-pays for services you receive and sometimes the co-insurance. Another important thing to know about Medicare Advantage plans is that they are required by Medicare to set an annual out-of-pocket limit. This out-of-pocket limit is like built-in financial protection because if you reach that limit, the plan would pay all of your costs for the rest of that year. There may be many Medicare Advantage plans offered in a region or a state or a county, and each one will have its own coverage and cost terms. Now let's talk about Medicare Part D. Medicare Part D is prescription drug coverage. You can get prescription drug coverage in two ways, either through a Medicare Advantage plan, like we just talked about, or through a standalone Part D plan. You can always remember prescription drug plans and Part D by thinking D is for drugs. Medicare requires that Part D plans cover all the types or classes of drugs that are normally used by Medicare beneficiaries. Every plan has a formulary or a list of covered drugs. So when you're choosing a Medicare Part D plan, it's really important to look at those formularies and make sure that the drugs that you take are on those lists. Costs for a Medicare Part D plan vary from plan to plan, but it usually includes a premium, and you'll probably pay a copay when you fill a prescription. What you pay in copays, again, depends on the plan and also on the formulary. Every plan places certain drugs on what they call tiers or levels of a formulary, and the level determines what you pay at the pharmacy counter. Usually the higher the level or tier, the more you'll pay. Costs for Medicare Part D will vary from plan to plan, but most plans have a pharmacy network. And if you fill your prescriptions within that network, you're going to get the best price for that prescription. Medicare supplement insurance is also called Medigap, and it's just what it sounds like. It supplements Medicare. Medicare supplement plans help pay some of the out-of-pocket costs that come with original Medicare Part A and Part B. Medicare supplement plans are standardized. They're labeled from A through N. There's 10 different plans with varying levels of coverage. So each Medicare supplement plan that has the same letter offers exactly the same coverage. However, plans may differ in what they charge. So a Plan G, for example, in one state may be a different price from Plan G in another state. The main purpose of a Medicare supplement plan is to cover the costs that come with original Medicare Part A and Part B. However, some Medicare supplement plan providers do offer additional programs that can provide discounted services for dental or hearing or other healthcare services. Medicare parts and plans can work together in different combinations to offer you the coverage you need. It really comes down to two scenarios. You can keep original Medicare Part A and Part B and decide to add prescription drug coverage and/or a Medicare supplement plan. Or you can choose a Medicare Advantage plan instead, which encompasses all of the coverage in one plan. People often ask, how do I know what's right for me? What Medicare plan should I choose? Well, that choice is personal because your health needs are personal, and each person needs to make a decision for themselves. There are a few things to think about as you look at Medicare plans and coverage in general. One, would you like to have additional benefits like dental or vision? If so, then a Medicare Advantage plan might be a better choice because they offer these options whereas original Medicare doesn't. Two, would you prefer to have lower monthly premiums and pay as you go, so to speak, when you go to the doctor with the copays? Or would you prefer to have higher premiums and fewer copays or out-of-pocket expenses? Number 3, do you have specific doctors or providers you like to see? Or do you travel frequently? If you do, Original Medicare might be a good choice for you because every provider in the United States is covered. Medicare Advantage plans often have a provider network, and you need to choose providers from within the network to get the plan's best prices. So there you have it. That's the basics of Medicare. And if there's just one thing that you take away from today, I hope it's this. You get to choose. You get to choose Medicare coverage that fits your health needs, your budget, and your lifestyle. If you need more information about Medicare basics or other Medicare topics, please visit us at MedicareMadeClear.com.